Hello and welcome. Today, we are going on a tour of one of the most incredible and invisible factories in the entire world, the one that's hidden inside your own body. We're going to pull back the curtain on drug metabolism, what actually happens to medicine after you take it. All right, let's get into it. I mean, really think about it. You swallow a pill, and then what? Where does it go? It doesn't just disappear into thin air. Nope, your body gets to work kicking off this whole series of mind-boggling chemical transformations. And that journey is exactly what we're going to explore. So, the official term for this whole process is metabolism. At its heart, it's your body's amazing cleanup system. See, most drugs are designed to be nonpolar, which basically means they're fat-soluble. That's great for helping them get into your cells to do their job, but there's a catch. If they stayed that way, they just get stuck in your body fat forever. So metabolism is the genius process of flipping a chemical switch, making them water-soluble so your body can actually wash them away. And the headquarters for this massive operation, the main factory floor where all the magic happens, you guessed it, it's the liver. I mean, sure, other parts of the body chip in, but the liver is the undisputed heavyweight champion of drug metabolism. It is just packed with all the special tools needed for the job. Okay, so how does the liver actually pull this off? Well, it's not just a simple one-and-done kind of thing. It's actually this really sophisticated two-phase operation. Think of it like a highly efficient assembly line that's designed to give a drug molecule a complete chemical makeover. The assembly line really has two main goals. First, as we talked about, it needs to make the drug less fat-soluble and more water-soluble. And second, it needs to change the drug's biological activity. Now, usually that means switching it off, but as we'll see in a bit, that's not always the case. Let's break down this assembly line. First up is phase 1, which you can think of as the prep stage. This is where enzymes, especially this super important family called cytochrome P450, get to work. They perform these little chemical tweaks to stick a reactive handle onto the drug. Once that handle is attached, the drug moves down the line to phase 2. The packaging stage. Here, the body grabs a big, bulky molecule and attaches it to that new handle. It's basically like putting the drug in a box, ready for shipping. And this is the beautiful result of all that work. After that final packaging step, the drug is totally transformed. It's now what we call a metabolite. And this new package is usually inactive and, most importantly, it's now water-soluble. That makes it super easy for your kidneys to grab it and get it out of your body through urine. Job done. Factory's closed for that molecule. But what if that factory doesn't run at the same speed for everybody, or even in the same way? This is where the story gets really, really interesting, because it turns out drug metabolism is full of wild cards that can completely change the outcome. So 3 of the biggest factors that can mess with how your internal factory works are your age, your unique genetic code, and this is a big one, any other drugs you might be taking. This is really the core reason why medicine is just not a one-size-fits-all deal. Let's start with how different drugs can interfere with each other. It's fascinating. Some things, like alcohol, for example, act as enzyme inducers. They basically hit the accelerator on your liver's machinery, making that factory run way faster. But then you have others, like the antibiotic erythromycin, that are enzyme inhibitors. They do the exact opposite. They slam on the brakes, slowing that whole assembly line way, way down. So what happens when the factory is running in overdrive? Well, it's not a good thing. A sped-up metabolism can chew through other medications way too quickly, sometimes before they even have a chance to work. And this can have really serious consequences, like oral contraceptives failing or chemotherapy just not being effective. And the flip side is just as scary. When those inhibitors hit the brakes and slow the factory down, other drugs don't get cleared out like they should. They can end up lingering in your system, building up to dangerous, even toxic levels. This is a huge deal for powerful drugs like the blood thinner warfarin, where the line between helpful and harmful is incredibly thin.
And then there are your genes. This is where it gets incredibly personal. Take a look at this example with a tuberculosis drug called isoniazid. It turns out the human population is split almost 50-50. About half of us are rapid acetylators. Our DNA gives us an assembly line that breaks this drug down nice and efficiently. But the other half of us, we're slow acetylators. Our factory line for this specific drug just runs slower. And the consequence? A dose that's perfectly safe for a rapid metabolizer could actually build up and become toxic for a slow one. It's literally written in our code.
All right, so far we've mostly talked about metabolism as a way to shut drugs down and throw them out. But the story has this amazing plot twist. The final product coming off that factory line, well, it isn't always just waste material. Sometimes it's the star of the show. It really boils down to three possible outcomes. The most common one is what we've been talking about. An active drug gets turned into an inactive metabolite. Simple. Sometimes an active drug gets turned into another active molecule, which is interesting. But the last one, this is the real shocker. The factory can take a drug that is completely inactive and flip the switch to turn it on. And this leads to this brilliant idea called a prodrug. It's a super clever strategy. Scientists will sometimes design a medication to be a total dud when you first take it. It does nothing. They are literally counting on your body's own metabolic factory to do the final step, to flip that switch and activate the medicine right inside you. It's an amazing way to make sure a drug gets absorbed better or delivered to just the right spot. Okay, so we've been on this pretty deep dive into this complex chemical factory. Let's bring it all back home. Why does any of this really matter to you and your own health? It matters because your body's ability to handle a drug is deeply, fundamentally personal. Think of it like a unique metabolic fingerprint, one that's shaped by your age, your DNA, and everything else in your system. This fingerprint is the real reason why a medicine might be a lifesaver for one person, but do absolutely nothing, or even cause side effects for someone else. And that really leaves us with one final, powerful question to think about. As our understanding of this hidden factory grows, we're moving into a new era of personalized medicine. The future isn't just about finding the right drug, it's about finding the right drug at the right dose that is perfectly tailored to your body's unique way of working. Thanks so much for joining me.